Dr. Brandy, I'm going to start with you. Across the country, states that protect abortion rights are preparing for a surge in patients coming from states where they no longer have the right to access the care that they need. Researchers estimate that 36 million women of reproductive age will now live under abortion restrictions and bans. In my home state of Washington, clinics are expecting to see 5 times as many out-of-state patients, and this is really a full-blown healthcare crisis that is going to cost women their lives and their health because they can't access the care they need from their own doctors in their own states. I want to thank you for providing such incredibly important care because the work you do is essential and it saves lives. Talk to us about how abortion bans in other states impact your work as a provider in New Jersey and the care that your patients receive.
Thank you so much, Senator, for the question. You're right. There's going to be millions of people that hopefully will be able to access care, and unfortunately will be leaving their homes and their communities in order to do so. I'm very fortunate to practice in New Jersey, where our governor and legislators have passed proactive laws to help protect the care in our state. Unfortunately, that's not the case elsewhere, and many people across the country will be leaving their communities to get that care. What that looks like is delays in care, which leads to patients presenting often later in pregnancy. It means patients may not be able to get to us because all of the logistics of travel, like childcare, like making sure people have days off of work, they have gas so they can get to their appointments, all lead to people not being able to access the care. And we know that that disproportionately impacts people of color and other people that are marginalized. People that live in states that the care is protected often are anticipating an upflow in people. People are going to be having to wait that live in those communities for weeks, and we're already seeing that in certain communities that appointments are taking 2-3 weeks to be able to get that appointment. And unfortunately, in pregnancy care, weeks matter, and that may create further barriers to people being able to access the care that they need and deserve.
Thank you. Ms. Stetzer, thank you for sharing your story and your mom's. I know it takes a lot of courage to speak out about a personal situation, and I'm really grateful that you were willing to do that today. You spoke really powerfully about your mom's experience before Roe and what happened to her, and your experience in what you happened in a world where we had Roe. Talk to me a little bit about what abortion rights means in your life.
Thank you once again for the opportunity to share my story, Senator. The first thing that comes to mind for me is that what a person does with their life after they have an abortion need not be exceptional for that abortion to be necessary. What they do with their life after that should be the same as the choice to have an abortion, entirely up to them. However, in my case, I'm pretty proud of the things that I've done in my life after having an abortion. Most importantly to me, having an abortion allowed me to be a support system for my brother and my sister when they became parents, when they chose to become parents. And I would say, probably most importantly to me, that having an abortion allowed me the time and resources to care for my mother as she got sick with cancer and eventually died. And so I am deeply grateful for the abortion that I had that allowed me to live my life as I wanted it to.
Thank you. And Dr. Taylor, as you mentioned, this crisis is not being felt equally. Black and Native American women, for example, continue to experience disproportionately higher rates of death related to pregnancy or childbirth. How will the overturning of Roe exacerbate the maternal mortality crisis in our country?
Thank you for the question, Senator Murray. You know, it is going to greatly exacerbate our maternal mortality crisis in this country. Based on research that was conducted not too long ago, we know that the fall of Roe will, cause our overall maternal mortality rate to increase by 20%. For Black women, it'll increase by 40%. And I think it's important to talk about the maternal mortality issue in this context because it's bigger than even the conversation we're having having today. Black women disproportionately are impacted not only by, the maternal mortality crisis, but also not unable to access abortion even before Roe. And so these challenges are going to be, basically insurmountable in a lot of ways. But as I mentioned in my testimony, there are solutions that can be implemented to address the issue.
Thank you very much. My time is up.